The cultural group that I chose to focus on for this week's discussion is Latin Americans. According to Hayes and Efford, counselors working with Latin American populations must understand the cultural values, systemic barriers, and social experiences that may influence the client's mental health and help seeking behaviors. One significant issue is immigration related stress. Some of these stressors may include anxiety related to documentation status, fear of deportation, discrimination, and language barriers. These experiences can contribute to depression, anxiety, and trauma related symptoms. Hayes and Efford explained that immigration experiences and stress related to adapting to the culture can have a substantial impact on the individual's psychological well-being and family functioning. The second issue is job inequality. Many Latin Americans are employed in lower paying jobs, and they're also employed in labor intensive jobs where they may face workplace discrimination, limited access to health care, unsafe working conditions, and financial instability. These occupational stressors can affect both physical and mental health and create barriers for obtaining counseling services. Based on my research, I believe that person-centered therapy would be an effective counseling approach when working with Latin Americans. Person-centered therapy emphasizes empathy, genuineness, and unconditional positive regard, which helps to build trust and rapport. Strong relationships are particularly important to many Latin American cultures. They place a high value on personal connections, respect, and family relationships. In addition, Algeria and colleagues found that barriers such as language differences, stigma, and limited access to culturally responsive services can affect mental health service utilization among Latinos. This research suggests that counselors who establish therapeutic relationships and provide culturally responsive care can improve the client engagement and outcomes. Several cultural barriers may prevent them from seeking counseling. One barrier is stigma surrounding mental health treatment. Some individuals may believe that personal problems or emotional problems should be handled within the family rather than discussed with a counselor. Another is a language barrier, especially first generation immigrants who may be more comfortable communicating in Spanish. Concerns about immigration status and lack of insurance coverage, and also mistrust with institutions could discourage individuals from seeking counseling. As a professional counselor, I would work to reduce these barriers by demonstrating cultural humility, providing services in the client's preferred language whenever possible, and incorporating culturally relevant values into the counseling process. I would also work with community organizations and educate clients and families about mental health resources to increase trust and accessibility.